So let's dive into a classic UKMLA OSCE case you're almost certain to come across: Meniere's disease. Welcome to this clinical walkthrough on the Meniere's disease case for UKMLA. This is brought to you by MEDIA, your 24/7 practice partner. Okay, so we're going to break this consultation down into 6 key stages. Nailing this structure is absolutely key to passing this station, so let's get started. All right, first up, Section 1, setting the scene. Those first few moments are so important. They really set the tone for the entire consultation. This is your script. Seriously, use these exact words. You introduce yourself, confirm who you're talking to, and then you get consent to ask questions. It's simple, it's professional, and it immediately helps the patient feel more comfortable. Okay, let's move on to Section 2, taking a structured history. Now, the very first thing you need to do here is figure out what on earth the patient actually means by their symptom. And this is probably the most important question of the whole consultation. Dizzy can mean so many different things, right? You absolutely have to get specific here, or you'll be lost. So you've got to figure out, is it true vertigo, the room is actually spinning, or is it more like feeling faint, or maybe just feeling a bit wobbly on their feet? For Meniere's, what we're really hunting for is that history of true spinning vertigo. Okay, once you've clarified that, it's time to dig into the details. Use a framework like DuPara. This is your safety net. It makes sure you don't miss anything important.
And when you get to other symptoms, these are the money questions. You're asking about hearing changes, ringing in the ears, and that feeling of fullness. These questions point directly to Meniere's.
Which brings us to a really handy mnemonic, DVTF. Think of it as your quick checklist. If the patient is ticking off deafness, vertigo, tinnitus, and fullness, well, your suspicion for Meniere's should be shooting way up. Okay, Section 3, screening and examination. This part is crucial. Before you even think about diagnosing something like Meniere's, which is a peripheral cause, you have got to rule out the scary stuff, the central causes. And this is how you do it. You ask these specific red flag questions. You're looking for any signs of a stroke or something else serious going on in the brain. Seriously, you cannot afford to miss this. Ask the questions, and then make sure you document that the answers were no.
Now, for this specific OSCE station, here's what you're going to find. The hearing test will be normal between the attacks, and the Dix-Hallpike test, it'll be negative. That's a big clue that helps you rule out BPPV.
All right, next up, explaining the diagnosis. Look, getting the diagnosis right is only half the battle. How you explain it to the patient is just as important. Keep it simple, no jargon. Here's a perfect simple definition you can use. It explains that it's an inner ear problem caused by fluid buildup that affects balance and hearing. It's easy to understand. Just use this one. And this is how you reassure them. You explain that it comes in attacks, but they'll feel fine in between. You tell them it's not dangerous, but you also acknowledge that it's really disruptive to their life. Then you finish by giving them hope that you can help. Just a quick reminder, you can practice this exact case right now and get some objective feedback over at mymediate.com. Okay, let's talk management plan. You need a solid, comprehensive strategy here. We're going to break it down into 4 main points. First up, medication. There are 2 key drugs you need to explain. Prochlorperazine is what they'll take during an attack to help with the dizziness and nausea. Think of it as the rescue medication. Then there's beta-histine. They'll take this one regularly to try and stop the attacks from happening in the first place. But remember, it's not just about pills. The rest of the plan is just as important. You need to make an urgent referral to ENT. You have to talk about safety, which means telling them to stop driving and to inform the DVLA. Then you offer practical support, like a letter for work, and you book a follow-up appointment. And that brings us to the final critical part, closing the consultation. You cannot finish without proper safety netting. It's an absolute must. So you need to be crystal clear about the warning signs. Tell them exactly what to look out for. If the dizziness doesn't stop, if they get weakness, if they suddenly lose hearing, or if they collapse. These are the red flags that mean they need to get help immediately. And to wrap things up, always give them a patient information leaflet. It helps them remember what you've discussed. Then the last thing you say is that simple, open question. Do you have any questions for me? It's the perfect way to make sure they've understood everything. And that's our walkthrough of the Meniere's disease station. Remember, you can practice this exact case right now on mymediate.com.